Good day, ladies and gentlemen. Today we continue talking about anatomy of locomotor system, and the topic of our today's lecture is the muscle anatomy, muscles, fascia, and topography. As you remember, muscles form the active part of locomotor system because without the muscles, bones and joints won't be able to move. This part of locomotor system, of course, very important because it not only produces the muscles but also responsible for basic metabolism of the body. And if the mass of the muscle is not enough, it can cause to such diseases as the obesity. During our today's lecture, we will talking about three main parts. The first part will be about the classification of muscles and also the muscles and topography of the trunk. Then we'll talking about the muscles and fascias of the upper limb and topography and muscles and fascias of the lower limb. After our today's lecture, you have to know the classification of muscles, main groups of muscles of the trunks and limbs, and main topographical formations of the trunk and limbs. After this lecture, you have to be able to explain the structure of the main topographical formations of the trunk and limbs and also their clinical importance. I hope you all remember histological classification of the muscle tissue. We can find in our body skeletal or striated muscles, also cardiac muscles, and smooth muscles or non-striated muscles. The topic of our today's lecture just the skeletal or striated muscles. I hope you remember these muscles are voluntary muscles, means under our voluntary control, under the brain control, and cannot work without it. The smooth muscles are involuntary. These muscles are under the control of autonomic nervous system, acting as automatically without our mind control. And cardiac muscle, it is separately because it is also striated, but it is involuntary muscle which is contracted from our delivery till the death and never stop. Each muscle is covered by the connective tissue, and this connective tissue is known as the fascia. The fascias can form some splitting and fascial sheaths or osteofibrous sheath around different groups of muscles. And now we're starting talking about anatomy of muscles of the trunk. And first of all, you have to know what is the trunk, what's the definition of trunk. So the trunk is the main body part including the back, chest and abdomen, excluding the head, neck and also the limbs. So let's start talking about the muscles of the trunk. All muscles of the trunk are classified by location into the muscles of the dorsal surface of the trunk, including the muscles of the back, and muscles of the ventral surface of the trunk. These ventral muscles are subdivided into the muscles of the chest, diaphragm, which is separately between the chest and abdomen, and also the muscles of abdomen. Muscles of the back. These muscles can be classified according to embryonic origin into the autochthonous or proper muscles and also the heterocthonous. Autochthonous muscles means the muscle developed from the myotomes of the back and stayed at the same place. The heterocthonous subdivided into the truncopital muscles and also truncofugal muscles, means replaced from the limbs to the trunk or from the trunk to the limbs. Muscles of the back, according to shape and location, are subdivided into the superficial and deep. Superficial muscles are heterocutaneous muscles, means originated in the trunk and replaced to the limbs, or originated in the limbs and replaced to the trunk. That's why these superficial muscles are subdivided into the muscles attaching to the bones of the upper limb, and because of that can produce in the movements of the upper limbs, and also the muscles attaching to the ribs. These muscles attaching to the ribs are very important because together with the muscles of the chest, they participate in the process of respiration. Deep muscles are long and short. These muscles are attached to the vertebrae and very important to keep the body in the upright position. These muscles, for example, the erector spine muscle is most developed in the human beings because of this upright position of the human body. Muscles of the back are also classified according to the origin, to the muscles of ventral origin. These muscles are got the nerve supply from the anterior branches of spinal nerves. Second group are the muscles derivatives of the fifth branchial arch. These muscles are innervated by the 11th cranial nerve, which is the accessory nerve. Especially the trapezius muscle is included in this group. And muscles of dorsal origin, these the proper muscles or deep muscles or orthocutaneous muscles of the back, these muscles are supplied by the posterior branches of the spinal nerves. Fascia of the back. Fascia of the back are represented by two main plates. The first one is the superficial or subcutaneous fascia. This fascia covers the body entirely and located deep to the skin. It is very thin. And the proper fascia of the back, which is the thoracolumbar fascia, is the layer of the dense connective tissue which covers the muscle. It consists of few lamina. The superficial lamina of proper fascia of the back forms the posterior covering of the superficial muscles. Middle plate of this proper fascia covers outside deep muscles. Deep plate of the proper fascia forms the anterior covering of the quadratus lumborum muscle. This deep fascia of the back, proper fascia of the back, which is the thoracolumbar fascia, it forms the osteofibrous sheath of the erector spine muscle. This osteofibrous sheath has the anterior wall, which is the deep lamina of the thoracolumbar fascia. Then it has the posterior wall, which is formed by the middle plate, reinforced by the aponeurosis of the serratus posterior inferior and aponeurosis of the latissimus dorsi muscle, and laterally the plates fuse together and form the sheath is enclosed by this way, and the medial wall is formed by the periosteum of the lumbar vertebrae and also the sacrum. By this way, the erector spine muscle is enclosed in the osteofibrous sheath. Osteo because it is partly formed by the vertebrae, and fibrous because formed by the fascia. One more topographical formation which is clinically is quite important and it is present in the lumbar region is the lumbar triangle or triangle of Petit. This triangle is bounded by the latissimus dorsi muscle laterally, by the external oblique muscle of abdomen medially, and by the iliac crest inferiorly. The floor of this lumbar triangle is formed by the internal oblique muscle. Why this triangle is quite important? Because it can be the place of herniation. It occurs not so often, but anyway, sometimes it is possible. And internal organs can be protrude through this triangle because it's somewhat like the weak spot in the region of the back, because here the layer of the muscles is thinner than usually. That's why internal organs can protrude throughout the muscles in between the muscular fibers of the transverse abdominis and internal oblique muscles. In the region of the chest, we can talking about some areas and also some projectional lines which are important for description of topography of that region, and also in future will be quite important for you in description of internal organs topography and also for description of localization of some pathological processes. Let's start with the boundaries of the chest or thoracic region. Superiorly, the boundary passes through the jugular notch, then passes through the superior edge of the clavicle. Laterally, this border passes along the posterior axillary line, and inferiorly it is the horizontal line which passes through the base of the xiphoid process. So let's now talking about the projectional lines present in this region. First is the anterior midline of the human body. It passes through the midline of the sternum, and posteriorly the posterior midline present. If we will connect these two lines, anterior midline and posterior midline, we will get the sagittal plane, which divides the body into two absolutely equal parts, right and left. Next line is the sternal line, which passes along the lateral border of the sternum. Then we have to draw the mid-clavicular line, which passes along the sternum through the middle of distance of the clavicle, and the parasternal line, which is located approximately at the middle of distance in between the sternal and mid-clavicular lines. Next line is the anterior axillary line. This anterior axillary line passes through the anterior wall of the axillary cavity vertically down. Mid-axillary line passes through the most deep place of the axillary cavity, through the most deep point of the axillary cavity, and posterior axillary line passes through the posterior wall of the axillary cavity, means through the anterior border of latissimus dorsi muscle. Also, we can talk at the posterior side of the chest about the scapular line passes vertically down through the inferior angle of the scapula. I mentioned above posterior midline, then the vertebral present as well, and paravertebral lines. Muscles of the chest are classified into the muscles of the ventral origin and some of the muscles are located at the back side. These muscles are usually described in the anatomy of the back. So now we're talking about the muscles of the ventral origin. These are the muscles supplied by the anterior branches of the spinal nerve, means by the branches of brachial plexus, short branches of the brachial plexus, and also by the intercostal nerves formed by the anterior branches of thoracic spinal nerves. By the topography, these muscles of the chest are subdivided into the attaching to the bones of the upper limb. That's why these muscles are also known as the muscles of the shoulder girdle. For example, these muscles are represented by the pectoralis major muscle, which is the most superficial, and also the pectoralis minor muscle, which is located deep to the pectoralis major. Then we can talking about the proper muscles of the chest or deep muscles of the chest. These muscles are the autochthonous muscles located deep in between the vertebrae and represented by the, first of all, by the external intercostal muscles and internal intercostal muscles. These external and internal intercostal muscles are the muscles filled in the intercostal spaces and attaching to the next above and next below vertebrae. Just the small space in between the muscles present, and this space transmits the neurovascular bundle represented by the intercostal arteries, intercostal veins, and also the intercostal nerves. Please remember, these vessels and nerves pass along the inferior border of the rib and inside of the sulcus and protected by the ribs. That's why if you need to perform the puncture of the thoracic cavity, you have to perform it just along the superior border of the next below rib to prevent the injuring of these vessels. The fascia of the chest is usually represented by the superficial fascia and also the proper fascia. Superficial fascia of this region continues from the region of the neck, and the feature of this superficial fascia and its clinical importance in the females, it covers and forms the capsule of the mammary gland. This fascia attaches to the clavicle, that's why it's like suspends the mammary gland. Next fascia is the proper fascia of this region, which is subdivided into two plates, the superficial plate and deep plate. Superficial plate covers the superficial muscles, which are the pectoralis major muscle, pectoralis minor, and so on. Deep plate of the proper fascia, it covers the subclavian muscle, also pectoralis minor muscle, and also the muscles located in this region. The axillary fascia is formed because of fusion the superficial and deep plates. It covers the serratus anterior muscle, which is also located in this region, and then continues to the axillary cavity. Thoracic plate or endothoracic fascia, it covers the external surface of the ribs, sternum, and external intercostal muscles. So it's thoracic plate. And endothoracic fascia is the next fascia, which is located inside of the thoracic cavity and lines inside this thoracic cavity. The fibrous and osteofibrous sheets of the chest area represented by two groups, by the fibrous sheets or fibrous covering of the muscles, and also the osteofibrous sheet formed by the fascia and also the related bones. So fibrous sheets are formed by the fascial covering of the pectoralis major muscle. Next is the fascial covering of pectoralis minor muscle and serratus anterior muscle. So all these three muscles, pectoralis major, pectoralis minor, and serratus anterior muscles, are located in the fibrous fascial sheets. Osteofibrous sheets are formed around the subclavian muscle by the fascia, proper fascia, and the clavicle, and also the intercostal muscles, because the fascia is attached to the ribs and form these osteofibrous sheets for intercostal muscles. The interfacial spaces of the chest region are represented by the mammary space enclosed by the superficial fascia of this region, then the retromammary space located behind to the mammary gland, superficial subpectoral space located between the pectoralis major and pectoralis minor muscle, and also the deep subpectoral space located between the pectoralis minor muscle and intercostal muscles. It's quite important to remember about these spaces, because these interfacial spaces could be the places of some separative processes location, some abscesses of ligaments location. And such quite common disease as the mastitis, which occurs during the lactation, located, for example, in the mammary space, if it is the tissue of mammary gland involved in the process. Sometimes this inflammation can be spread to the retromammary space and cause to formation of the retromammary mastitis and retromammary abscesses. Sometimes the abscesses and phlegmons can be located in the superficial and deep subpectoral spaces as well. One more topographical formation which is related to the chest is the axillary cavity and also the axillary fossa. It's in between the chest and the upper limb, because related to the shoulder girdle and also to the thoracic region. And I'd like to explain first what's the difference between the axillary cavity and the axillary fossa. The axillary fossa is covered by the skin. That's why to see it you can just put up your arm and look to the mirror. You will see the skin and can describe the boundaries of this axillary fossa. The axillary cavity is located deep inside, and to see it we have to do the incision, and after the dissection or during the surgery in living person we can find the blood vessels and lymphatic nodes, nerves located in the axillary cavity. This axillary cavity is pyramidal shape and has 4 walls. The anterior wall of this cavity is formed by the pectoralis major and pectoralis minor muscle. The middle wall is formed by the thoracic wall, which is covered by the serratus anterior muscle. The lateral wall is formed by the region of the arm, by the humerus and also the muscles of the arm. and posterior wall is formed by the subscapular muscle and muscles of the shoulder girdle. So in the anterior wall of the axillary cavity, we have to remember about three triangles, three topographical regions or three triangles. These triangles are represented by the clavipectoral triangle, pectoral triangle, and subpectoral triangle. The boundaries of the triangles. Clavipectoral triangle is bounded superiorly by the clavicle and inferiorly by the superior border of the pectoralis minor muscle. Medially, it's bounded by the region by the lateral border of the sternum. Then, pectoral triangle corresponds to the boundaries of pectoralis minor muscle and bounded superiorly by the superior border of pectoralis minor and inferiorly by the inferior border of pectoralis minor muscle. And the last triangle is the subpectoral triangle, which has also superior and inferior border. Superior border is formed by the lower margin of the pectoralis minor muscle, and inferior border is the inferior edge of the pectoralis major muscle. These triangles are especially very useful in description of the axillary artery. And in future, during study of angiology, of course, you will return back to these triangles of the chest. Next very important part of the human body is the region of the abdomen. The boundaries of the abdomen, superiorly it is the horizontal line drawn through the base of the xiphoid process, and I hope you remember the seam is the inferior border of the thoracic region. Lateral border is the axillary line, posterior axillary line, and inferiorly it is bounded by the iliac crest laterally, then the inguinal fold, which corresponds to the inguinal ligament, and the superior border of the pubic symphysis. So this is the region of the abdomen. Then also we have to remember about the lines used for description of topographical regions of this description of topographical regions of the abdomen. The first line, which passes horizontally through the most lower parts of the costal arcs, is known as the bicostal line. And one more line is the line connecting the anterior superior iliac spines, also passing horizontally. This line is the bicostal line. So bicostal or linea bicostarum and bispinal or linea bispinarum. Because of these two lines, the region of abdomen is subdivided into three big topographical regions: the epigastrium, mesogastrium, and hypogastrium. Then we can also draw two vertical lines along the lateral borders of the rectus abdominis muscle. By this way, the region of abdomen is subdivided into 9 regions. 3 of these regions are unpaired and 3 of the regions are paired. So, epigastrium is divided into 3 regions. The first one is the proper epigastric region, and 2 paired are the left and right hypochondriac regions. So proper epigastric, right and left hypochondriac region. The region of mesogastrium is also divided into 3 regions. The umbilical region is in the center. It is unpaired, and left and right lateral abdominal regions present here. And hypogastric region, it is subdivided into the pubic region. Also in some textbook you can find the suprapubic region, and left and right inguinal, or in some textbooks you can find ilioinguinal regions. These are the symptoms. These knowledges about the topographical regions are very important for description of the internal organs location, for example. But when you will describe the location of the internal organs, please never use the sentence as the organ located, like the stomach, for example. The stomach is located in the epigastric region. It's never been located in that region, because the regions described before are the regions of abdominal wall, and we can see these regions looking to the patient or even on yourself if you are looking to the mirror, but you will not able to see the organs. Organs are located inside of some cavities and can be just projected to the abdomen, can be just projected to the epigastric or hypogastric region. And if you describe the location of the organs, you have to tell it is located in peritoneal cavity, for example, and projected to that or this region of the abdominal wall. Muscles of the abdomen are the muscles of ventral origin. That's why these muscles are supplied by the anterior branches of the spinal nerves. According to their location and shape, these muscles subdivided to the anterior lateral group and also posterior group. Anterior lateral group subdivided according to the shape of the muscles into the long muscles and also the broad or wide muscles. Long muscles occupy anterior part of anterior lateral abdominal wall and represented by the rectus abdominis muscle and very small pyramidal muscle located inside of the rectus sheath. These muscles are very important for bending of the trunk, also for rising of the pelvis if the patient or subject in the lies position, and like another muscles of the abdominal wall, like the broad, including the broad muscles. These muscles form the muscles of abdominal press because they are very important for creation of inter-abdominal pressure. This pressure responsible for keeping of the internal organs in anatomical position. That's why the physical trainings for development of the abdominal press are so important. The broad muscles occupy the lateral aspects of the abdominal wall and placed in 3 layers. The most superficial layer is formed by the external oblique abdominis muscle. Deep to it is the internal oblique abdominis muscle, and the most deep of the broad muscles is the transverse abdominis muscle. The fibers of transverse pass in this transverse direction. Together with the long muscles, these lateral muscles also responsible for inter-abdominal pressure. That's why included to the muscles of abdominal press. And posterior group, usually it is describing sometimes as the muscle of the back. It's the quadratus lumborum muscle, which is located, which is related to the lumbar region and located most anterior of the back muscles. As usually, superficial and proper fascia of these regions present. The feature of the superficial fascia of this region, in the hypogastric region, this fascia splits into two plates, the superficial plate and the deep plate. Proper fascia has the superficial plate, which covers the external oblique muscle of the abdomen, intermediate layer or plate, which covers the internal oblique muscle of the abdomen, and deep plate, which covers the outer surface of the transverse abdominis muscle. Next fascia is the endoabdominal fascia. It's similar to the endothoracic. This endoabdominal fascia is the internal lining of abdominal cavity. It is the boundary of abdominal cavity. And depending to the muscles covered by this endoabdominal fascia, we can distinguish 5 parts of it, represented by the transverse fascia. It is the covering of the transverse muscle. Diaphragmatic fascia, where it covers the diaphragm. Iliopsoas or psoatic fascia, where it covers the iliopsoas muscle. Endopelvic or pelvic fascia in the pelvis. Then the fascia of the quadratus lumborum muscle, also known as the fascia quadrata. You have to remember about the weak spots of the abdominal wall. What is the weak spots or weak places of the abdominal wall? The places where the hernias can occur most often. Because in these places the layer of muscular covering is too thin. Some spaces in between the muscles could be present, or because of some other reasons. These weak spots or weak places of the abdominal wall are represented by the inguinal canal, by the umbilical ring. It is the white line of the abdomen above the umbilicus. It is the linea alba. Also the rectus sheath, its posterior wall below the arcuate line, and also the semilunar line. It is the line or Spegelian line where the transverse abdominis muscle continues from the fleshy part to the aponeurotic part. Depending to these weak spots of the abdominal wall, we can tell about anatomical classification of hernias or herniation. What is the hernia? The hernia is the protrusion of the internal organs with the peritoneal covering into the subskin layer. Depending to the location, we can talk about the hernias of the linea alba, represented by the epigastric hernia, umbilical hernia, and periumbilical hernia. Then, hernias of the Spegelian lines, inguinal hernia, femoral hernia, and about the lumbar hernias, we were talking in description of muscles of the back. Inguinal canal. Inguinal canal is the slit-like space located above the middle and medial parts of the inguinal ligament. It is the gap in between the broad muscles which is formed in the embryonic life during the process of testis descent, the process of descending of testis into the scrotum. And in male it contains the spermatic cord, while in the female it contains the round ligament of the uterus. Because in the females the ovaries will not descend somewhere because they are stopped by the broad ligaments of the uterus in the cavity of the small pelvis. But still in inguinal canal the remnants of gubernaculum ovarii is present, and it is transformed into the round ligament of the uterus. This inguinal canal has the external or superficial inguinal ring and internal or deep inguinal ring. These the openings transmitting the spermatic cord, and these openings are located in the walls of the inguinal canal. To understand the walls of the inguinal canal, you have to remember the position of the muscles, position of the broad muscles of abdominal wall. So, anterior wall of the inguinal canal is formed by the aponeurosis of the external oblique muscle. What is aponeurosis? Such broad muscle like the external oblique have the fleshy part which is formed by the muscular fibers and aponeurotic part which are formed by the connective tissue. We can compare it with the description of the ligaments and also the membranes. Same in the muscles, the tendons present, which are the quite long bundles of connective tissue for attachment of the muscles to the bones, and also the big, broad tendinous structure, which is known as the aponeurosis. So, below the spina umbilical line, it means line connecting anterior superior iliac spine with the umbilicus. The muscular part of the external oblique muscle is disappear because it is transformed into the aponeurosis. So, this aponeurosis then attaches to the anterior superior iliac spine and also to the pubic tubercle, and in the inferior part form the thickening which is known as the inguinal or Papard's ligament. So this anterior wall of the inguinal canal is formed by the aponeurosis of external oblique muscle. Posterior wall of the inguinal canal is formed by the transverse fascia and peritoneum. Transverse fascia, as you remember maybe, is the part of the endo-abdominal fascia. Superior wall of the inguinal canal is formed by the free parts or free borders of the internal oblique and transverse abdominis muscle, because these muscles are not attached to the inguinal ligament and got these free borders. And inferior wall is formed by the inguinal ligament mentioned above, which is formed by the folding of the aponeurosis of the external oblique muscle. For understanding of the inguinal hernia, we have to tell about the inguinal space or inguinal gap. It is not the same like the inguinal canal, because the inguinal canal, it passes obliquely from the internal to the external inguinal ring, but the inguinal space or inguinal gap is the distance in between the superior and inferior walls of the inguinal canal. So here you can see the sagittal section through the abdominal wall, and here three muscles are represented: the external oblique, internal oblique, and transverse oblique. Then you can see aponeurosis of the external oblique muscle, which curves down and backwards and form the thickening, which is the inguinal ligament. And posteriorly, as you remember, transverse abdominis muscle is covered by the transversalis fascia. So by this picture, the walls of the inguinal canal are demonstrated, and I will repeat again. Anterior wall formed by the aponeurosis of the external oblique abdominis muscle. Superior wall is formed by the free margins of the internal oblique and transverse abdominis muscle. Posterior wall is formed by the transversalis fascia, and inferior wall formed by the inguinal ligament. So the inguinal space, as I told before, is the distance in between the superior and inferior walls of the inguinal canal. Size of these spaces, size of this inguinal space can lead to the hernia. It could be the condition of the hernia formation. As bigger is the size of this space, as often the hernias occur. According to the anatomical structure of the male's and female's body, the inguinal space is wider, is bigger in the males than in the females, because the pelvis of the males, it is more narrow and higher, while the pelvis of the females is wider and shorter. That's why the inguinal space in the females will be more narrow, and inguinal hernias practically never occur in the females. But femoral hernias, we'll talk in the future, can occur in the females more often than in the males. Inguinal hernia classification. The hernias, as I told you before, is the protrusion of the organs covered by the peritoneum, this is the hernial sac, into the area of the inguinal canal to the contents of the abdominal cavity. So these hernia are classified into the oblique and straight. The oblique hernia, it passes throughout the inguinal canal, because first it exits from the abdominal cavity via internal ring or deep ring of the inguinal canal, then passes throughout the canal obliquely and exits via the superficial ring and get to the scrotum. Quite often such oblique inguinal hernia are the congenital disease, because the layers of tunica vaginalis testis are not closed because of any reason in embryonic life. Second variant are the straight hernia. Such hernia does not pass throughout the inguinal canal. This hernia will pass just through the superficial ring of the inguinal canal and will not descend to the scrotum area. Linea alba is the next weak spot of the abdominal cavity. This linea alba is the fusion of crossed fibers from the eponeurosis of the broad abdominal muscles from the opposite sides along the midline. Along the midline, these fibers fuse with each other, and here the muscular parts of the muscles are absent. That's why this area is the weak spot of abdominal cavity. Will the herniation occur or will not in the linea alba depends on individual features of this or that person, because the possibility of this herniation depends to the individual structure of this linea alba. In some persons, in between the fibers of eponeurosis, the spaces are quite big. This reason first can cause to protrusion of the preperitoneal fat and forms the preperitoneal lipomes. Then, because this gap will be increased in size, it gives possibility for herniation. And here you can see like the hernia is formed completely. Linea alba is wider and thinner above the umbilicus. Above the umbilicus it is about 2-3 centimeters, and below the umbilicus it will become more narrow but more thicker. So it's just 2-3 millimeters, but it is thicker, especially because of that the herniation occurs most often in the region above the umbilicus. The opening in the linea alba is known as the umbilical ring or the navel, and it is the opening in the linea alba actually. That's why sometimes it also can be the weak spot, and the umbilical hernia will be formed in this region. Linea alba is the place where the vessels and nerves are practically absent. That's why it is the most common place for surgical approaches for organs of abdominal cavity. At the same moment, this is the place where the vessels and nerves are practically absent. That's why the healing of this place will be not so fast like in the regions where the vessels and nerves more developed. That's why in this region, after the surgery, some postoperative hernia can occur as well. Next weak spot and next topographical structure which is related to the abdominal wall is the rectus sheath. It is the fibrous sheath which is formed by the eponeurosis, by the connective tissue of the broad muscles of abdomen around the rectus abdominis muscle. And this scheme will help you to understand the structure of this rectus sheath and also the differences in its structure in the region above the umbilicus or above the arcuate line and below the arcuate line. What is the arcuate or Douglas line? This Douglas or arcuate line is located approximately 4 centimeters below the umbilicus, and it is curved. That's why the arcuate. Along this line, the changes in the structure of rectus sheath will occur. What are the differences in this rectus sheath structure? So, in the region above the arcuate line, the rectus sheath is formed by one complete aponeurosis from the external oblique muscle and superficial lamina of aponeurosis of internal oblique. So you can see near to the lateral border of rectus muscle, aponeurosis of the internal oblique abdominis muscle splits into two plates, superficial and deep. Superficial passes anterior to the rectus abdominis muscle, that's why participates in formation of anterior wall of the rectus sheath. Deep plate passes posteriorly to the rectus abdominis muscle, so it participates in the formation of the posterior wall of the rectus sheath together with the complete aponeurosis of transverse abdominis muscle. So we can tell above the arcuate line, anterior wall of the rectus sheath is formed by the 1.5 aponeurosis of the broad muscles, and posterior wall also by 1.5. Posterior to this wall is the transversalis fascia, then the preperitoneal fat and peritoneum, parietal peritoneum. What happened below to the arcuate line? Below to the arcuate line, all three aponeuroses of the broad muscles will replace to the anterior wall or anterior surface of the rectus abdominis, forming something like the connective tissue belt for reinforcing of this anterior wall of rectus sheath, because the hydrostatic pressure, because of pressure of internal organs, as below it this pressure higher, and this somewhat like the belt prevent to extension of the organs through the muscle. And posterior wall of this aponeurosis is practically formed by the transversalis fascia and also the preperitoneal fat and parietal peritoneum. So if we're talking about the connective tissue structure, it's practically just the transversalis fascia. So it will summarizing the structure of the rectus sheath. Above to the arcuate line, it is formed anterior wall by 1.5 aponeurosis and posterior also 1.5 aponeurosis. Below to the arcuate line, anterior wall is formed by all three aponeuroses of the broad muscles. Posteriorly is just the transversalis fascia.